Have you ever felt a small discomfort grow into a constant shadow, a sensation that whispers in every quiet moment and lingers in every action you take? For those living with chronic kidney disease, persistent itching is not just a symptom. It is a reminder of the hidden battles within the body, battles that often go unnoticed by the outside world. It is easy to dismiss itching as a minor inconvenience, but for many, it becomes an unrelenting presence, gnawing at focus, disturbing rest, and challenging the very patience of the human spirit. Yet, in the midst of this discomfort lies an essential truth about resilience, about the human capacity to seek understanding in the face of suffering, and about the power of knowledge to illuminate paths that were previously shrouded in confusion. We live in a world where the invisible struggles often define the strength of an individual more than visible triumphs, and the quiet torment of CKD-related itching is no exception. The body communicates in subtle ways, and it is our responsibility to listen, to interpret these messages with care, and to act with wisdom. Toxin accumulation, mineral imbalances, and changes in the internal chemistry of the body are not just medical phrases. They are the language through which the kidneys speak to us, urging attention, respect, and mindful action. When we learn to observe these signs, we begin a journey not merely of treatment but of understanding. A journey that mirrors the philosophy of life that Dr. Mathew R. Weir has long emphasized, that true healing emerges when knowledge meets intention and awareness meets courage. Each individual's experience with CKD is unique, and yet there is a shared thread of perseverance that binds all who face this condition. In recognizing this shared struggle, there is both solidarity and strength, a recognition that though the path may be steep, no one walks it entirely alone. Motivation, in this context, is not a fleeting emotion, but a deliberate choice to confront reality with dignity and clarity. It is the decision to learn, to adapt, and to transform limitations into opportunities for growth. The journey begins the moment one acknowledges the discomfort, the moment one refuses to be defined solely by symptoms. It is a commitment to explore causes, to investigate how mineral imbalances can provoke relentless itching, how toxin buildup can disturb the harmony of the body, and how proactive measures can lead to tangible improvements in quality of life. It requires patience, persistence, and the willingness to look beyond the immediate frustration to the long-term possibility of relief. The mind, often overshadowed by the body's demands, becomes a critical partner in this endeavor. To cultivate resilience, to embrace the philosophy that even the smallest steps can accumulate into profound progress, is to honor the human capacity for endurance. And while medical advice, dietary adjustments, and safe treatment strategies are essential, so too is the mindset cultivated in the process, the inner strength that refuses despair, that seeks solutions even when the journey feels overwhelming, that listens to the wisdom embedded in the teachings of those like Dr. Mathew R. Weir, who remind us that understanding and patience are as vital as any medicine. Each day becomes an opportunity to engage with the challenge, not passively but actively, to recognize that the itch is more than irritation. It is a message, a signal to become attentive, to learn, and to act with deliberate care. In embracing this perspective, suffering transforms into insight, discomfort into awareness, and a seemingly insurmountable obstacle into a catalyst for empowerment. It is here, in this space between frustration and comprehension, that the first seeds of motivation are planted. The realization dawns that the human spirit, when armed with knowledge, compassion, and steadfast attention, can navigate even the most relentless of trials. Each individual's journey through CKD-related challenges is unique, yet the principles that guide relief are universal. Understanding the body, respecting its signals, seeking guidance, and adopting safe strategies that honor both mind and body. It is a reminder that the pursuit of wellness is as much an inner endeavor as it is a physical one, and that the philosophy of holistic care, inspired by thinkers like Dr. Mathew R. Weir, provides a framework to navigate life with courage, insight, and enduring hope. As we move deeper into understanding the nature of CKD-related itching, a sense of suspense builds, not the suspense of a story with an ending unknown, but the suspense of discovery, the quiet tension of uncovering truths that have remained hidden within the body for far too long. Itching, though often dismissed as trivial, is in fact a profound signal, an urgent whisper from the internal world demanding attention. It is here that the mysteries of chronic kidney disease begin to reveal themselves. For beneath the surface lies a complex interplay of toxins, minerals, and biochemical imbalances that disrupt the natural harmony of the body. These disturbances do not announce themselves with drama. They creep in silently, their presence felt only through subtle yet persistent discomfort. The suspense lies in the uncertainty, the quiet question that every patient and caretaker silently asks, why is this happening, and when will it stop? The answer is not simple, and it is not immediate, but it is attainable through knowledge, awareness, and careful action. Dr. Mathew R. Weir has long emphasized that understanding the root causes of any health challenge is as essential as addressing its symptoms, for without insight, any treatment is incomplete, any relief temporary. In the case of CKD, the body struggles to filter toxins effectively, allowing waste products to accumulate in the bloodstream. These toxins, often invisible and unassuming, provoke reactions that manifest as itching, inflammation, and general discomfort. Yet the story does not end with toxins alone. Mineral imbalances, particularly involving calcium, phosphorus, and magnesium, further complicate the picture, creating conditions that intensify the physical sensations and amplify the psychological weight of the experience. It is within this complexity that suspense becomes motivation, a call to engage with the unseen, to uncover the hidden mechanisms that drive the body's responses. Each day lived with these symptoms becomes a challenge of patience and observation, where attention to detail, tracking diet, monitoring hydration, seeking medical advice, becomes a lifeline. The mind, confronted with a persistent and mysterious irritation, has the opportunity to cultivate resilience, to convert discomfort into awareness, and to recognize that every symptom is a guidepost, pointing toward deeper understanding and eventual mastery of one's health. This journey, though fraught with uncertainty, is rich with potential for growth, for those willing to embrace the lessons embedded in the experience. The suspense heightens when one realizes that relief is possible, yet it is not accidental. It must be sought intentionally, through safe interventions, lifestyle adjustments, and knowledge-based strategies that respect the body's intricate design. Dr. Mathew R. Weir's teachings remind us that each step toward understanding is itself transformative, that every small insight into the workings of the kidneys, the accumulation of toxins, or the correction of mineral imbalances, carries the potential to reshape the experience of living with CKD. There is a paradox in this suspense. The more one confronts the mystery, the more one discovers control, for knowledge turns uncertainty into strategy, and discomfort into actionable wisdom. The body, once perceived as a source of limitation, becomes a partner in the quest for wellness, providing signals, prompts, and feedback that, if interpreted wisely, guide toward meaningful relief. The suspense of not knowing is replaced gradually with the satisfaction of learning, and in this space, motivation flourishes. Understanding that persistent itching is not a failure of the individual, but a reflection of the body's current imbalance, transforms the narrative from one of helplessness to empowerment. It encourages the viewer to actively seek safe treatments, monitor progress, and recognize the impact of small, consistent interventions. Each corrective action, whether through dietary management, hydration, gentle skincare, or consultation with healthcare professionals, represents a step out of the shadows of uncertainty into the light of clarity and control. And as one engages in this process, the philosophical dimension of care becomes evident, that health is not merely the absence of symptoms, but the cultivation of knowledge, attention, and resilience. It is here, in the tension between suspense and understanding, that the teachings of Dr. Mathew R. Weir resonate most powerfully. They remind us that the journey through CKD is both physical and mental, that relief is not accidental, and that empowerment emerges from the deliberate choice to learn, to observe, and to act. In embracing this awareness, the individual transforms the experience of persistent itching from a source of despair into a profound opportunity for insight, self-mastery, and hope, a realization that within the complexity of the body lies not just suffering, but the possibility of enduring strength and renewed vitality. The journey from understanding to action is where true empowerment begins, and for those living with CKD-related itching, this stage is both transformative and liberating. Having recognized the subtle signals of the body, having felt the suspense of uncertainty and the weight of persistent discomfort, one now steps into a space where knowledge becomes power and intention becomes healing. Relief is not a distant dream, but a tangible outcome when approached with care, patience, and informed strategies. Safe treatment methods, whether guided by medical professionals or inspired by the teachings of experts such as Dr. Mathew R. Weir, serve as bridges between suffering and comfort, turning the once overwhelming challenge into manageable steps. Moisturizing the skin with gentle hypoallergenic products, balancing hydration, adjusting diet to address mineral imbalances, and following the right therapeutic guidance are not merely tasks. They are deliberate acts of self-respect, affirming that the body's signals matter and that personal well-being is worth consistent attention. But beyond these practical steps lies a deeper truth. Healing is as much a mental and emotional endeavor as it is a physical one. The mind, previously burdened by frustration and helplessness, becomes a source of strength when it learns to align understanding with action. By observing patterns, noting triggers, and committing to safe interventions, one cultivates not only relief from itching, but also a profound sense of agency over life circumstances. There is an elegance in this process, a philosophy that mirrors the insights Dr. Mathew R. Weir has long shared, that health is a dynamic interplay between awareness, action, and perseverance. Every small choice, opting for a skin-friendly lotion, moderating phosphorus intake, scheduling routine checkups, or adhering to prescribed treatments, is a declaration of resilience, a commitment to a future where quality of life is not dictated by symptoms, but shaped by conscious care. Motivation here is not fleeting. It is reinforced daily through the visible improvements that come from consistent, informed effort. Each night without relentless itching, each day where comfort returns to simple movements, becomes a testament to the power of understanding and the efficacy of mindful practice. And yet, this transformation is not limited to physical relief alone. It extends into perspective, teaching patience, gratitude, and the profound value of attention. When one learns to honor the messages of the body, the experience of living with CKD transforms. Challenges no longer appear as insurmountable obstacles, but as invitations to deepen self-knowledge and resilience. The teachings of Dr. Mathew R. Weir remind us that such transformation is holistic. The mind, body, and spirit are inseparable partners in the journey toward wellness. As relief from itching begins to take shape, the individual gains a renewed appreciation for the subtle equilibrium required to maintain kidney health, understanding that prevention, monitoring, and balanced care are lifelong companions. It is here that motivation and philosophy converge, where practical action meets reflective insight, and where living with CKD becomes an opportunity not merely for survival, but for mastery over one's health and well-being. Empowerment, therefore, is not found solely in the absence of discomfort, but in the deliberate choice to engage with life fully despite it, to embrace strategies that are safe, sustainable, and informed, and to approach each day with awareness and intention. For viewers seeking guidance, the message is clear. You are capable of reclaiming comfort, managing your symptoms, and enhancing your quality of life. The journey may demand patience, it may require trial and adjustment, and it may test resolve. But within these challenges lies the potential for profound growth. Every action taken to restore balance, every insight applied to improve daily living, reinforces the belief that the human spirit is resilient, and that suffering can be transformed into knowledge, clarity, and hope. In aligning with these principles, inspired by the insights of Dr. Mathew R. Weir, individuals learn that CKD is not merely a series of limitations, but a landscape for conscious action, reflection, and improvement. Relief from persistent itching is achievable, and in its attainment, one discovers not just comfort, but a renewed confidence in the ability to navigate life's broader challenges with resilience, wisdom, and courage. This journey emphasizes that the path to wellness is ongoing, that it requires commitment, and that it rewards those who approach it with both mindfulness and informed action. And as this understanding takes root, one realizes that CKD-related itching, while frustrating, is also a teacher, a reminder that health is a dialogue between the body and the self, a call to respect, understand, and act. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.